Hey guys, Dr. Kyle Lovelace here. Hey, I want to shoot a real quick video for you just on chiropractic and how chiropractic actually works, how we see really cool stuff happen like back pain and neck pain going away, but also things like digestive issues getting better, like ulcerative colitis, or even things like allergies or asthma. We see changes in that, headaches, all kinds of issues, nerve pain like numbness, tingling down the hands, down the legs, sciatic nerve issues. The list really goes on. High blood pressure we've seen get better just with chiropractic care. And I want to walk you through how that actually happens. That it's not we're not actually curing anything, we're not treating anything. Ultimately what we're doing is helping people's bodies give the optimal ability to heal so that the body can then heal itself. Okay, so we're removing interference and giving your body the ability to heal. That's how chiropractic works. That's the philosophy behind it, that your body heals from the inside out, not from the outside in. It doesn't need help healing, it just needs no interference. So I want to walk you through how that actually works. So I have this spine here, right? And you can see in the spine is encased, so the spine actually encases the nervous system, it encases the spinal cord. It's the one organ that's completely encased in bone. It's crucial to our health and it's very, very sensitive as well. So the spine protects the spinal cord. That's its first main function. The second function is it needs to be able to move, okay? That movement is the key to life. They've shown that 90% of the stimulation to your brain, which is the start of the nervous system, 90% of the stimulation to your brain comes from the movement of your spine. In the world we live in today, we're sitting so much and we live such a sedentary lifestyle, so it's really leading to a lot of the diseases that we deal with. So just getting your spine moving again with chiropractic sets your body up for success and your brain to function at a higher level. Most of the research on chiropractic care actually is showing that it increases the function of the brain and stimulates the brain and affects the brain more than it does anything else when it comes to things like pain and things that really chiropractic is known for. So when you look at the spine, you want to have a curve in the neck from the side, a curve in the mid back, and a curve in your low back. And by having that creates a structurally sound, biomechanically sound structure so that weight from gravity can be evenly distributed throughout your spine. In that position, you don't get disc herniations, and if your spine's moving, you're not going to get spinal degeneration. Ultimately, your spinal cord can be nice and relaxed. You can see these little yellow things, these nerves come out. They go to organs, they go to tissues, they go to cells in your body. They tell your muscles to work, they tell your heart to beat, all those different things, right? So that's what runs every organ. So your brain sends a signal down the spinal cord, that goes out to individual nerves, that tells your heart to beat, lungs to breathe, everything else to happen, okay? Now it's a simplified version of what's happening there, but ultimately this is your electrical system, okay? Think of it like Duke Energy, if you live here in Charlotte or wherever your electrical energy system is in your town. Think of it as like, that's Duke Energy. Up here is the brain, the spinal cord is all the wires going throughout the town, those nerves are the wires in your house, right? And those organs are your light bulbs and your energy and all the things you use for electricity in your house, right? That's how that kind of works. And any interference along that chain is going to stop the light bulb. Well, it's the same thing to the nervous system. If we lose the curve in our neck, it stretches the spinal cord, puts your body into a diseased state. If your spine shifts the wrong direction or it's not moving, it irritates these nerves and then in return slows the energy or electricity, you could say, the energy to the organ, which eventually breaks down that organ. Immediately starts building disease, but eventually literally breaks down the organ like a heart attack or a digestive issue or anything else and creates stress within the body, okay? So that is kind of the basics there of the body and the spine and the nervous system. Now I'm going to talk to you about how when we adjust somebody's spine, how it actually gets rid of symptoms. So you get things like, or helps the body heal better. So when we adjust the spine, it puts a motion into the vertebrae, in return blocking what's called a stress response in that area that has happened from the subluxation of the locking of the spine, blocks the stress response and allows the body to get back to balance or homeostasis, which now allows the body to heal. They've shown that getting adjusted increases your IgA levels, which IgA levels are a huge part of your immune system. So we'll see immune issues get better. We'll see people that used to always have colds and allergy issues and all these other things no longer have allergies. And I'm going to walk you through the different levels of your spine. Okay, this poster here, you can see the cervical, thoracic, lumbar, and sacral area of your spine. I'm going to walk you through the different areas, and if you're subluxated or if your spine isn't moving properly in that area of the spine, if the vertebrae aren't moving properly in that area of the spine, how that can actually lead to health issues down the road, or in the case of pain, even immediately. So you got the top part of your neck here. You can see C1 headaches, insomnia, migraines, amnesia, dizziness. I would actually add in the main things we'll also see is it affects the vagus nerve, which is your parasympathetic nervous system, which is relax, digest food, sleep. So I'll see major digestive issues stemming from problems in the upper part of the neck or not being able to sleep or anxiety. C2, sinuses, allergies, earaches, crossed eyes, deafness. And so I have patients that many times will get their hearing back or their eyesight back. I have a patient right now, Rebecca, who I've told this story before on videos, but she actually is getting her eyesight back and has to change her prescription from getting chiropractic care. Pretty cool. Okay, so you got C2 is sinuses, so allergies are going to stem right here. Almost anytime someone comes with a sinus issue and we start adjusting here, it drains like crazy. It's really cool. Okay, we got acne at C3, eczema, so skin issues at C3, C4, hearing loss, runny nose, adenoids. That's also the area that goes right to your thyroid and the area that goes into the upper shoulders, okay, your traps. You got C5, which is laryngitis and sore throat. C5 also goes into your shoulders and to the shoulders. And then you got C6, which is chronic cough, pain in the upper arm. So that's what controls your bicep muscle. It also goes down to these fingertips right here, okay? C7, you got bursitis, colds, thyroid conditions. C7 also goes to these fingertips and here, C7 and C8 does. Okay, you got T1, which is asthma, cough, shortness of breath. T2, functional heart conditions, certain chest conditions. When we start adjusting the upper thoracic spine, so get this, so when you're here, right, all the weight of your head, guess where it's going? Right there, right there. Right to the heart, okay? So that's the heart and the lungs, and they've actually shown in studies that this forward head posture or loss of height actually increases mortality rates of heart and lung issues because you're putting so much pressure into the upper part of your neck, which are the nerves that stem out to the heart. Okay, if I cut the nerves going to your heart in that area, your heart would stop working. So we know that's a very crucial and it's connected, but we're not cutting these nerves. You're simply just irritating the nervous system, decreasing the flow of energy to the heart, and the heart will slowly start to break down. I've seen arrhythmias where we will adjust the spine and the arrhythmias stop in the moment, right? Or they'll completely decrease. I've had patients that are told they need to have open heart surgery, right? And they put stents in their heart, and we start adjusting them and they don't need it anymore. That's from their cardiologist, not from us. I'm just telling you that's what's happened. Pretty cool. And you'll see blood pressure issues change and things like that as well. So T3, bronchitis, pneumonia, congestion, influenza. T4, jaundice, shingles, gallbladder conditions. Okay, that's that kind of upper back area. T5, arthritis, fevers, blood pressure problems, liver conditions, poor circulation. T6, indigestion, heartburn, and dyspepsia. So indigestion, heartburn. T6 is a very, very common area we'll see with acid reflux. And it's very common in our world today because we're like this. Plus we're eating junk, but that area actually goes to what's called the gastric esophageal sphincter, which is what you need to close so acid doesn't come back out of your stomach. Okay, so you got T7, which is ulcers and gastritis. T8, which is lowered immunity. And T9 is allergies and hives. T10, kidney troubles, artery hardening, chronic fatigue, and nephritis, so kidney issues right into this area, adrenal issues as well. T11, acne, pimples, eczema, boils, so T11 relates back to the skin as well. T12, rheumatism, gas pains, certain types of sterility. L1, constipation, colitis, dysentery, diarrhea, hernia. We'll see a lot of digestive issues from lower back pain issues. You actually see lower back pain and digestive problems kind of go hand in hand if it's there chronically. L2, cramps, minor varicose veins, difficulty breathing. L3, bladder and menstrual issues, irregular periods, miscarriages, and bedwetting. L3 is a very common area. Again, you see the miscarriages there. L4, sciatica. So this is those nerves going down the back of your legs. They come from L4, L5 in that area right there. And those are the huge nerve that goes down the back of your leg. And if any irritation of that nerve, it'll cause pain and all kinds of issues. And if you felt that, you know what I'm talking about. Painful urination. So we'll see bladder issues in that area. And that actually will happen. If you have damage to your spinal cord or spinal nerves in that area, it'll literally, incontinence will happen. You won't be able to hold your bladder anymore. Lembaga, which is back pain, swollen ankles, cold feet, poor leg circulation at L5. So we'll see cramping in the legs is very, very common at the L5 and sacral area. And then sacral iliac conditions and spinal curvatures will stem from issues at the sacrum. So here's how a spinal curvature could happen because of a sacral issue. Okay, your sacrum, let's say it's tilted one direction, well, that's the base of your spine. So if the base of your spine is shifting in the wrong direction, the rest of your spine has to adapt to be able to see straight, okay? So a sacral issue can actually lead to that. It'll also see things with menstrual cycle issues, coccyx, you can see things like hemorrhoids as well. So this whole thing is intricately connected to every organ, tissue, cell in your body. The movement of your spine decides how healthy your body is. We always say, look near to the spine for the cause of all disease, because it starts at that point. It works its way out to every organ, tissue, cell in your body. When you're getting adjusted, when you're getting chiropractic care, number one, it's removing the stress in the spine, which allows the rest of your body to heal itself. It's literally a physical stress on the body, so it helps balance your nervous system back to homeostasis. It also blocks irritation to the individual nerves in those areas. So it gets rid of the irritation going to those nerves, and that's why someone will come in. The ones we can understand are the pain syndromes, right? Somebody comes in with neck pain or shoulder pain or upper back pain, and we adjust their spine, and they think, and the pain goes away. It's very easy in their mind to say, okay, we got pressure off the nerves, we got rid of the nerve irritation, and now I don't have pain. And that's easy to understand. But because we don't feel the nerves going to the heart, or we don't feel the nerves going to the digestive system, it's a little bit harder to understand that when you're getting adjusted, it gets pressure or irritation off that nervous system and allows your body to heal from the digestive issue. Great story I have is Vanessa, a patient of ours in the past, that she came in and she had a loss of curve in her neck, but the main reason she came into our office is because she had ulcerative colitis, and she was told, and I wish I don't have it with me right now, but I can show you guys at some point. She was told that she needed to be put on a colostomy bag. Like they did the colonoscopy, found ulcerative colitis bad enough to where they wanted to put her on a colostomy bag. She's 32 years old. And she'd been a patient of ours in the past for back pain, hadn't seen her in a while. She came back with this issue and said, hey, I remember what you told me about the nervous system, what I just told you guys, and how it controls everything. Please help me. So we took x-rays. We went through the same process we do with anybody that comes in, because it's a spinal, we're looking at the spine, we're not focused on symptoms. And we started getting pressure off her nervous system, started getting the curve back in her neck. Adjusting C1 was the main focus in her low back. And within 120 days, it was about 4 months, because they say 120 days you get a new digestive system. Well, she actually did a colonoscopy 4 months later, redid that colonoscopy, completely clear. I had the before and after colonoscopy written up by the doctor. Really cool story. So that's just cool, because we didn't adjust her spine and get rid of ulcerative colitis. We adjusted her spine, removed the interference to her nervous system. Her body healed from ulcerative colitis, because ulcerative colitis is just ulcers in your stomach. Just like if you had an ulcer in your skin, it has the ability to heal. You just have to remove the stressor. You know, Dr. Patrick Flynn, I listen to him all the time and with the Wellness Way, and one thing he always says is, hey, if you're night, if you're waking up and stubbing your toe, well, your toe's never gonna heal, because you gotta remove the stressor. Once you stop stubbing your toe, now your toe has a chance to heal. The same thing with the rest of the body, okay? So our job is to remove the interference, give you the ability to heal, because that's how your body works. Your body is always trying to adapt and to heal itself. It always does the right thing. It doesn't make mistakes. Don't listen to the medical world that's gonna tell you gotta take a pill for this, or a drug for this, or cut out this organ. It's not important. Every organ is important. Your tonsils, those are all important. I'm trying to think of all the stuff they cut out and tell you is not important. Your tonsils are important. Everything's important. Your gallbladder is essential. You need it to break down fat. Every organ is essential, and we don't just cut them out just because they're seemingly not working well. We find the root cause of the problem, and that's the core of chiropractic in the first place. The philosophy is, again, your body has this amazing ability to heal. It heals from the inside out, doesn't need help. We just need to remove the interference and give your body what it needs in the term of nutrients, minerals, and everything else. Cool? Hey guys, if you're listening right now and you're someone that's dealing with anything I just said up there, or dealing with any kind of pain syndromes, anything like that, chiropractic is the answer for those things. So I want to give you this opportunity. If you're listening right now and you saw this video, simply just go to queencityhealthcenter.com. You can actually schedule an appointment time, say you saw this video. We'll honor that and give you a first evaluation in our clinic at a discounted rate, an opportunity to really find out what's going on in your health. Cool? All right, again, queencityhealthcenter.com. I'm Dr. Kyle Lovelace. We have a clinic in South Park and Matthews, and we hope to see you soon. Hope you got a lot out of that. Guys, share that, like it, love it. I think that a lot of people need to understand that chiropractic isn't some like unscientific thing that, you know, people say and that you know, medical doctors tell you that shouldn't be done because it's dangerous. It's very safe, and we've get amazing results with health naturally. Cool. You guys have an awesome day.